Thanks, Cathy, for joining me today just to give an update on this Providence Care and stuff. And I just want to get your, what's the current situation at Providence Care? And
yes, thanks for inviting me, David. I have to say I'm very proud of my staff and the teamwork that has happened here that has allowed Providence Care, both at our hospital site and at the Providence Manor site, which is our long-term care site, to not only be an outbreak and go through quarantine, but also to get through it without infecting or passing on the virus to any of our patients or our residents. We've worked really hard with infection prevention and control and with the occupational health and safety to make sure that our patients are as safe as possible, our residents are as safe as possible, and that our staff remain safe. COVID was on the radar for occupational health and infection prevention and control way back in January, and we started planning and taking measures then and educating staff at all levels of the organization to please not show up for work. If they had any symptoms, to connect with occupational health and safety immediately so we could get our staff tested. And our staff did get tested. And with our close relationship with public health, they were able to do all the contact tracing, and we were able to isolate our patients and our residents at the manor to make sure that they would be safe. Staff that tested positive were in isolation for 14 days, and those staff have now returned to work or will be returning very shortly. As at today, no patients in our hospital, no residents in our long-term care home, or clients that we give care to in our 22 community programs, or staff are positive for COVID-19 and in an infectious stage. I'm not quite sure about the science as to whether or not the 4 that tested positive will actually continue to test positive, but they will have immunities and they will have no symptoms. But we work really closely with occupational health and safety, our division and our organization, and they are the ones that are responsible to give the staff person the okay to return to work. So we're taking a very scientific approach. We're following all of the ministry directives about personal protective equipment. We work cooperatively with our partners, both at Public Health and 3SO, which is our central buying organization, to get us the right amount of personal protective equipment. As everybody knows, that is a scarce resource. So we want to make sure that we're using it according to the scientific evidence and that we're protecting our patients and our staff from this disease.
The things, Cathy, I also read on your website you were doing virtual visits and developing some of the wellness plans and stuff.
Yeah, I think this crisis has had us all think about different ways that we can deliver care. And if I take a look at our manor, Providence Manor, the long-term care home, where the people that receive care there are very vulnerable and fragile in their health, our recreational staff stepped up big time to provide activities to staff and iPads to staff so that staff and the residents, for staff to help the residents stay connected with their family members, because there is a visitor restriction. So only if someone is coming to the end of their life is a visitor allowed to come and be with one of our residents. So we had to take a look at how do we keep people occupied when there are no more group activities, there aren't visitors coming into the home, We know that 80% of the people that we give care to at Providence Manor have some level of dementia. So it's very difficult for them to understand what's going on. And our recreational staff and our nursing staff have been outstanding in providing activities to keep people in their room, to keep people 6 feet away from each other, and making sure that they're not congregating in areas where it's known from the science of the disease to have people in congregate settings pass the virus from one to another. Our first line of defense is rigorous screening at our front door. So we're making sure no one is coming into Providence Manor that has any symptoms of acute respiratory illness. And the same at our hospital. And while the ministry didn't mandate us at the start of this to take those kind of precautions at the hospital, we knew that the staff that we have and that the patients and residents that we have in the hospital are just as vulnerable. And we implemented vigorous screening at the hospital, the same as we did in the long-term care home, as soon as we could. So it is a difficult time. It's worrisome. It's very different. Our hospital looks different. Our long-term care home looks different. And both of them feel different because the normal activities that happen here aren't happening right now.
Just finally, how are you doing, and like everybody around you doing with all these the kind of restrictions and stuff?
Yeah. Well, it is, as I said, a worrisome time, and we're very conscious about keeping physical distances, even within the hospital, even within people that are going to the cafeteria or coming in the door. We've got tape on the carpets and on the floor to make sure everybody stays the right distance away from each other. I would say when we had the outbreak at Providence Manor, the environmental staff and all the other staff that work there, no one called in sick. Everybody called in to come and help. And I think because our staff are committed to Providence Care, the Sisters of Providence are still an inspiration to us. They believe that the vulnerable people needed care and have inspired us to continue to care for the vulnerable population. Our staff have been coming to work. Now, in long-term care, if they're working at more than one location, according to the emergency directive that was announced by the ministry this week, they have to pick a place to work. So we don't know, to the extent of our staff, how many people work in different locations. So we're working through people identifying if they want to come and work with us or they want to work somewhere else. We have hired additional staff in the last month. I think we have 60 new staff that are starting, both in the care delivery side of the organization and for all of our other areas like environmental services, like education, like different support service areas. So we do have 60 new staff starting between the two sites. So I think we're very concerned, but we're very blessed that people still want to come and work at Providence Care every day. More than 50% of our staff have worked with us for more than 10 years. And I think that commitment to the people that we give care for and to the corporation is admirable, and it's putting us in a very good position of being able to manage this very difficult time in our healthcare system.
Thanks, Cathy. It's a good place to end. I hope you stay safe, and thanks again for the update.
Thanks, David. And I would like to give a shout out to all the staff and all the different teams of people that have come together in different ways to give the patient the safest possible care. And to the people at our manor that are keeping our residents occupied, the people that you expect to always be there are there. Our recreational staff, our environmental services staff, our infection prevention and control staff, as well as the nursing staff that are caring for these people every day. Food services, everybody is working together as a team. It's amazing and it's awesome. So I do want to thank everybody for that.